Hello and good afternoon. My name is Melina Malkani, and I'm currently a high school student at the Bullis School in the United States. Specifically, I'm from Bethesda, Maryland. I've created a presentation on a topic that's increasingly important in our digital age, the design of a health dashboard. In a world of technology, AI, the internet, and data-driven healthcare, it's imperative for the public to be able to understand data easily in order for them to take charge in their own well-being. One of the easiest ways to receive health data is from reading dashboards. However, if the dashboards are hard to read, then they are of no use to the public. That's why I've researched the best practices for the design of health dashboards. I believe my research results will make an impactful change to the health dashboards if implemented. I have spent numerous hours conducting research on this topic, and I'm very passionate about improving social good. On the screen, I have linked my email and contact information as a resource. Please feel free to take a picture or write down my contact for more information about the best practices for the design of health dashboards. The start of my research began during the height of the COVID-19 pandemic due to my brothers and I curiosity of the impact of COVID in our community. We decided to check our county's COVID dashboard for data which included hospitalization numbers, deaths, and cases. However, the data was hard to read, even for educated individuals. I thought, how will elderly people be able to make informed health decisions if they can't understand the dashboard? So I decided to research how to make dashboards easier to understand for the public. Therefore, I initially came up with the top 10 best practices for the design of COVID-19 dashboards, and recently got published in the Journal of Perspectives in Health Information Management. But I realized those practices could work for all types of health dashboards. For example, monkeypox or a cancer dashboard. In order to conduct this research, over the past year, I've led a team of 5 or 6 high school students to enhance our research. This way, I made sure we were getting many different perspectives and viewpoints that were brought to the table. Currently, the research topics that my team and I have focused on have been health informatics, medical informatics, and data visualization. These keywords have allowed us to focus on data informatics to enhance health dashboards. As a certified Tableau creator, it has been very insightful to be able to identify the use of diverse chart types of displayed data. For example, bar charts, pie charts, line charts, and others. In the future, I'm looking forward to expanding my research into improving non-medical dashboards, such as financial dashboards, and scientific dashboards, such as biomedical dashboards. Dashboards are the future of interpreting data and provide a visual representation of complex data sets. However, until users quickly and easily understand trends and patterns and insights displayed in a dashboard, they will not be able to be used to their full potential. I'm seeking a co-author on this research to create a well-designed dashboard to produce better informed health decisions. A well-designed dashboard can produce better decision-making by the public, academics, managers, organizations, and etc. The methods. My team and I have created a 250-person survey, including many different demographics, asking questions about the necessity of each of the best practices of health dashboards that we have researched. Those are easy navigation, high usability, use of adjustable thresholds, use of diverse chart types, compliance for Americans with Disability Acts, use of charts with tabulated data, incorporated user feedback, simplicity of design, adding clear descriptions of charts in comparison with different entities. The conclusion of the survey aligned with our best practices because the percentage of agreement with all the best practices was over 75%. Additionally, we have looked at over 100 different COVID and health dashboards and collaborated with the Montgomery County, Maryland dashboard team. After we collaborated with the Montgomery County dashboard team, they had implemented the practices we suggested into their dashboard to improve their own design. During our survey, we made sure that we implemented many different demographics. For example, we sent the survey to different participants that live in seven different states and across 5 different age ranges. This ensured that we would get varying perspectives towards our data. Our results. Due to the inclusion of our methods, we realized that the public agreed with all of our best practices with a high agreement rate. So we decided our top 10 best practices would consist of easy navigation, high usability, use of adjustable thresholds, use of diverse chart types, compliance with Americans with Disability Acts, use of charts with tabulated data, incorporated user feedback, simplicity of design, adding clear descriptions of charts, and comparison with different entities. Here's an example of a great design of a dashboard. As seen, it contains two different chart types that allows users to understand the data in two different ways. Additionally, this dashboard contains a clear title that allows users to understand data and that allows users to know exactly what they're talking about. Lastly, the only improvement for the design would be to pick colors that are ADA compliant. Around 300 million people around the world are colorblind, and it is important to have a dashboard that are inclusive to all users. Next is an example of a poorly designed dashboard. Just on one page, there's too much information displayed. First, the colors are not ADA compliant because they're using lighter colors instead of bold colors to indicate a change on the graph. Second, there's not an option to change thresholds of the graph. It only contains data of a 30-day time period. Third, the titles of the graph are not descriptive enough for the users. However, displayed are multiple different chart types that can be useful to a user. Lastly, the references. I will display my contact information for any additional questions. Thank you. And now I have time for questions.
Okay. Thank you very much. Quite impressive work. Are there any questions on the floor?
Hi, Melina. First of all, I just wanted to say that in high school, having that kind of clarity and rigor, it's pretty fascinating, because back when I was in high school, I couldn't imagine doing even 1% of what you've achieved. My question is, where do you see this project going? Like, you have surveyed dashboards, like what's your next step with the work that you've done till now? I know you're asking for collaborators, but I just want to know what you plan to do when you find the collaborator.
So my next step would be to find maybe the 15 best practices and narrow it down to maybe 12 of the best practices for health dashboards. And then hopefully, instead of health dashboards, I can go on to non-medical dashboards, such as like financial dashboards or maybe science dashboards, and just in general have the best practices for dashboards in general.